seen that one scene from the movies. You know the one. A character wakes up from a coma, opens their eyes perfectly, and asks for a sandwich. That's the fairy tale Hollywood sells you. Unfortunately, it's not even close to reality. I'm a CCRN-certified ICU nurse, and I manage comas for a living, and I'm even at the bedside when that patient eventually wakes up. And what movies show you is not only inaccurate, but it's downright dangerous, because it sets up families with expectations that can never be met. Welcome to my Hollywood versus ICU reality series, and today we're going to break down a couple of myths. Alright, let's break down the first myth. In movies, coma patients look like perfect actors. Flawless skin, perfect hair, and peaceful expression, just resting, right? Here's what's actually going on. For a patient that is completely still and is not moving, your muscles begin to break down in about a week. By 6 weeks, you're going to need rehab and significant therapy to be able to regain function. Then there's the skin. Without movement, your body weight begins to crush your tissues against the bed. And if the pressure isn't relieved, blood flow eventually stops and your tissues die, which results in a pressure injury. That's why in the ICU, we have to turn our patients every 2 hours, because if you don't, their skin will eventually break down and cause an infection. But no movie will show you that. For myth number 2, I feel this is the worst one. Myth number 2 is something that always gets me, and I never understand why Hollywood does this, but it's the instant awakening. The patient always opens their eyes, they smile, and they whisper something meaningful. And I get it. It's clean, it's cinematic, and it looks good. Here's the reality. When someone wakes up from a coma, it usually isn't spontaneous. It means we, the ICU nurses and the doctors, lower their medication that is keeping them sedated. And eventually, we are able to turn it off completely. But this is not a random process, and we have to actually do this carefully, or else they could possibly end up in a worse condition than they were already in. This isn't just a moment, this is a carefully thought of process. Waking up from life support isn't as peaceful as it looks in movies. In reality, it's very chaotic. Patients usually wake up hallucinating, fighting. They usually have to be restrained for a certain period of time until they're able to get their bearings. They're combative and they're hallucinating. And this is something that we call ICU delirium. Waking up isn't beautiful. It's a carefully monitored process. Hollywood sells a fairy tale because the truth is uncomfortable. Waking up is a battle of sedation, lines, and really 24-hour monitoring. Then, when you finally wake up, you have to go through months of agonizing therapy just to regain your function. And a quick disclaimer, this is for information and educational purposes only. This is not medical advice. Go to a doctor. That being said, let me know in the comments what movies you thought were totally fake and what other topics you want me to cover. If this hits different, make sure you like and subscribe, because next week I'm going to be talking about the biggest lie in film history. I'm breaking down why shocking a flatline, the thing that you see them do in every single movie, would actually kill a patient. Stay tuned. This is DTV, and I'm out. Peace.